To assess frontal plane joint kinematics, again, our camera needs to be aligned perpendicular to the frontal plane, and we'll be using a high-speed recording so we can see the amount and extent of motion that is occurring. I'm going to freeze the image or slow it down to the point of right foot initial contact. He's displaying a rear foot strike pattern, which is difficult to see from this view, so best appreciated from the sagittal view. But nonetheless, we can see the initial contact occurring on that posterior lateral corner of his right foot. Now, as we advance forward from initial contact toward mid-stance, if we estimate where his center of mass is, we can drop our line of gravity down and indicate where the foot falls relative to that line. In running, it is not uncommon for the foot to fall on this line or even cross over to the opposite side, depending on how fast they're running. So if an individual is running at high speeds, near sprinting speeds, the foot will typically cross over this midline. At slower running speeds, the foot will either be close to the line or just adjacent to it on the right side, in this case, of the line. Because of this fairly narrow position of the foot with respect to the center of mass, there is very little medial lateral displacement of the person's center of mass during running. So again, if we hold our arrow on this spot, the individual may drift a little bit side to side in the treadmill belt, but you'll notice that his position, medial lateral displacement of his center of mass, is minimal. Now let's advance again to our right initial contact, advance toward mid-stance, and notice the amount of contralateral pelvic drop that becomes more apparent. Along with that, you can begin to see now, following the curvature of his spine, that there is an ipsilateral lateral flexion of the trunk. That if we trace this the lumbar spine and then follow it up into the thoracic, we can begin to see an alignment such as this, which is quite common in our runners. And with the amount of ipsilateral lateral flexion will increase fairly proportional to the amount of contralateral pelvic tilt that we see. Now, as we advance forward into our running stride, that contralateral pelvic tilt is reduced back into a more neutral position. The trunk correspondingly is in more of a neutral position with respect to the vertical, and it remains so through the push-off aspect of the gait cycle. This view also allows us to appreciate the amount of vertical displacement, mid-stance being its low point, mid-flight being its high point. Now I've zoomed in a little bit to the rear foot so we can see where contact is occurring. When one lands on the rear foot, again, the posterior lateral corner makes contact. The pressure then shifts more toward the medial aspect of the foot as the entire foot makes contact with the ground. As we advance to mid-stance, we can appreciate the amount of rear foot eversion that's present by bisecting that portion of the shoe, what's called the heel counter, and then bisecting the lower leg. That gives us an estimate of the amount of rear foot eversion that would be present, and in this case shows us to be in a fairly typical position. I've once again asked our runner to adopt a forefoot strike pattern so we can see some of the differences in terms of frontal plane motions of the foot. When we go to initial contact on the right side, again, we can see just how lateral contact is made. This is typical for a forefoot strike pattern, and that contact does not occur under the first and second metatarsal areas, but first contact happens more at the fourth and fifth area. The pressure is rapidly moved over to the medial aspect. So if we back up 2 frames, initial contact is here, with pressure largely in that area. As the vertical ground reaction forces increase and the load on the foot increases, the pressure and the center of the pressure rapidly moves toward the medial or middle portion of the forefoot. The heel is then partially lowered, and in some individuals may never make full contact with the surface, while others it does. If we advance to our mid-stance position, and again, attempt to determine our rear foot eversion. I'm going to redraw that line a little bit. The amount of toe out plays a little bit of challenge with determining this orientation. But again, you'll generally see that the amount of foot pronation or rear foot eversion decreases a bit in forefoot runners. And then the remainder of the gait cycle remains relatively the same to a rear foot strike pattern. The key difference then between a forefoot and a rear foot strike runner is the first half of the stance phase.